Good morning, everyone, and thank you for the opportunity. Uh, I'm Raj UKZN, basically a non-practicing pharmacist, mostly a researcher in medicinal chemistry. What I'm trying to present here is, yes, antimicrobial resistance is a great problem, and uh, as a department and School of Pharmaceutical Sciences, we have taken a number of initiatives, and we are consistently developing the curriculum. And I'm going to highlight certain subjects which we are focusing more and incorporating making the students aware about the antimicrobials and antimicrobial resistance. Um, Coming here, right from first year onwards to the final year, the students are made aware of the various aspects of antimicrobial drugs, both in clinical aspects and in the research aspects as well. When I joined UKZN, I saw a big gap between, there was more focus on pharmacology, dispensing, and knowing about dispensing and awareness and so on, and pharmacy practice. But I felt there was a little bit gap with respect to medicinal chemistry. Being a pharmaceutical chemistry and medicinal chemistry, I saw there was a gap. So we came up with a module in Farm 251, which basically deals with drug designing and understanding the drugs. I feel it is very important for a pharmacist, as a pharmacist, to know, not to just know the pharmacological aspects of that, but to understand the structure of the drug. So this module basically covers everything, and some of the things which are... Sorry about this. Thank you. So some of the basic things what we cover in this is basically this whole module is based upon the chemistry of the drug. So the concepts of physiochemical properties, starting from your different classes and the structure activity, more focusing on the SAR, mechanism of action, then synthesis of some important drugs. This goes in concurrent with your practical modules where they synthesize some of the drugs. Prior to these modules, in the first year, they are introduced to basic concepts of medicinal chemistry and organic chemistry. Some things which are covered are anti-infective agents, your sulfonamides, antifungal agents, urinary tract infective agents, and antitubercular agents. From here, some of the pharmacological aspects, building on the chemistry, then coming on to the pharmacological aspect of it, and molecular biology aspect of it. The pharmacology aspect, if you look here, the Pharm 302, which is taught in third year, and there are about 16 lectures and 45 minutes lectures. And what they basically focus on is mechanism of action, therapeutic indications, and adverse effects at the pharmacological point of view. The antibiotic stewardship is not covered per se, but we are looking into it, and we are trying to develop that, incorporate that aspect. Professor Sabia Isaac is a Saki chair, and she leads this antibiotic resistance, and she is spearheading this aspect of streamlining the whole module towards making awareness of antimicrobial resistance and antibiotics. So in 2017, we have requested her to incorporate some tutorials and so on to make the students aware of these things. Followed by this, we have pharmaceutical microbiology, that is Pharm 321. Here, the antibiotics is also covered in the third year module. There are 44 into 45-minute lectures are delivered. So these topics topics that are covered here are classification of microorganisms, the structure requirements for growth, enumeration, metabolism, and so on, sterilization methods, resistance and mutation, and microorganism in pharmaceutical and medical relevance. What we propose to do, we are teaching about the antimicrobial and about antimicrobes in our programs, but we need to as I said, we need to more streamline this. So what we are proposing is we want to build up on the existing what we are teaching. So yeah, here are some, and build up and add some new topics and cover the gaps and, of, and focus it more towards the antibiotic stewardship. So here, covering from historical perspectives, then classes of antibiotics, the principal clinical antibiotic therapies, like inter alia, indications, dose, durations, route of administration, pharmacokinetics, pharmacodynamics, then antibiotic resistance, mechanism of resistance, dissemination of resistance, and risk factors for the development and spread of resistance. And followed by some more like more on pharmaceutical surveillance, like surveillance of antibiotic resistance with respect to both national and international context, then development and implementation of antibiotic policies at both at national and institutional and community levels, then antibiotic stewardship, introducing antibiotic stewardship guidelines, including diagnostic stewardships, and then further continuing like working in antibiotic stewardship and conservation initiatives, introducing these concepts, what are done by WHO and other NGOs like your APUA and CDDEP and GARP. Then coming up with a One Health approach, as my previous presenters have mentioned about One Health approach, not just about human beings, but incorporating the environmental effects, the veterinary science, and various other aspects of it. Then also the socio-behavioral and cultural aspects related to antibiotic presentations, dispensing, distribution, and consumption, that is prescriber per versus user perspectives, socio-political and economic factors that govern this, and awareness and education and innovative products and technologies. Thank you.